outside the tent, and when the patient is inside, we close the walls here with a zipper. And in this part of the bed, we have altogether 4 infrared lamps, and they radiate infrared A waves, which is warmth, the warm part of light. And infrared A penetrates the skin and leads to a gentle overheating of the patient's blood, and through this overheated blood we eventually create fever. The fever we create goes up to 40.5 centigrade, which is around 103 Fahrenheit, 104 Fahrenheit. And this is fever that is comparable to the fever that is produced naturally when we are infected with a virus, for instance. Fever is a very effective and wise reaction that is developed in all mammals and in humans to overcome diseases. And while we have fever, our immune system is very, very active. Why do we treat patients that suffer from cancer with whole body hypothermia? The answer is that whole body hypothermia gives an enormous stimulus to our immune system and our white blood cells. And it creates the production of so-called heat shock proteins in cancer cells that make cancer cells more visible to our immune system.
This makes an increase of the granulocytes or the macrophages, the eater cells which go and eat detritus from the cancer. They eat cancer cells themselves, they attack better. So we have a macrophage activation in the whole body hypothermia.
We increase the blood flow, not only in the area where the tumor cells are in an organ, in a metastasis, but everywhere in the patient's organism, so that we can enhance the effect of parallel given infusional therapy, even with this type of hypothermia.
And it keeps about 2 weeks. It's measurable that the granulocytes, they get into a more enzymatic activity for about 2 weeks after a 3 to 4 hours hypothermia. We do it every week, normally once, maximum twice per week, so that it increases more and more the white blood cells activity.
But it is more than that. It is also a very effective way of detoxification, and by perspiring 2 to 3 liters of body fluid, we cleanse the body from toxins through active perspiration.
This sweating is like in infrared sauna also. When we measure the sweat for toxic things, they make a secretion of lipophilic toxins, spray toxins, xenohormones, and so on.
There are many non-toxic treatments for cancer that are very effective and support and enhance the quality of life. And in the combination, they add up to a synergy effect that is even a lot stronger.